How to use affordable health plans for families properly. Beginner mistakes that cost you. Finding affordable health plans for families is more than just finding the cheapest option. Most families make mistakes that cost them in coverage gaps or unexpected medical bills. The first mistake is focusing only on monthly premiums. While a low payment may seem ideal, high deductibles or limited coverage can lead to huge out-of-pocket costs when a family member needs care. Consider the total cost of care, not just the monthly bill. Another common error is ignoring family-specific benefits. Pediatric care, vaccinations, dental, and vision coverage can vary greatly between plans. Choosing a plan without these essentials can leave your children unprotected. Many parents also overlook provider networks. If your preferred pediatrician, specialists, or hospitals aren't a network, you'll pay more or face restricted access. Always check the network carefully before enrolling. A surprising mistake is not taking advantage of family discounts or government programs. Some plans offer multi-child discounts, and programs like CHIP can provide additional savings. Missing these opportunities can cost hundreds annually. Finally, beginners often fail to review plans annually. Children grow, health needs change, and new coverage options or subsidies appear each year. Reviewing your plan ensures you're getting the best balance of affordability and protection. To properly use affordable health plans for families, consider total costs, ensure essential family benefits, check provider networks, leverage discounts and programs, and review annually. These steps keep your family healthy while protecting your wallet.